COVID-19 numbers, they are back on the rise. Plus RSV and flu season, they're right around the corner. Today in your To Your Well-Being, we're going to talk about all three and what we need to do to stay healthy. Today we have Infection Prevention Medical Director of Cone Health, Cynthia Snyder. All right, first and foremost, let's talk about what happened today. Big news.
Right. So the FDA finally approved the new mRNA vaccine that's been formulated for kind of like the latest strains of COVID. It's a it's just a monovalent vaccine that targets that XBB Omicron subvariant strain, but it's really believed to provide broad coverage and still provide really good immunity for the other circulating strains that we have now.
Okay, so approved today, and so they say that it's going to be available maybe even sometime as early as next week.
That's correct. And it's available for anybody that's 6 months or older. And it's also has streamlined, if somebody's never had the vaccine, even the previous vaccines, they only need actually just one dose.
Okay, fantastic. Good to know. All right, let's talk about those COVID-19 numbers because we're seeing them rise again. Kind of what's adding to that rise?
Well, it's not unusual to see some increase in the late summer. We've had that happened in previous years, and especially if coming off of Labor Day, I think a lot of people may have been with family members or their friends, and then it falls in play with also kids being back in school. So there's a lot of opportunity for people to get exposed, and I think that's what we're seeing with the increasing numbers that we have in the community, as well as patients coming to the emergency room and the also urgent care, and our numbers in the hospital has increased a little bit over the last few weeks as well.
With that said, in the last couple of weeks, I've seen more people wearing masks. Is that something that you think that we should start considering?
I think we will definitely probably promote masking in the once respiratory season starts. I think at this time, if somebody is non-immune or hasn't had the recent vaccine, who is immunocompromised, that may be reasons to wear a mask, especially if you're going into a crowded setting.
Okay, and so at this point, are masks required or anything like that in hospitals or doctors' offices?
Right now, we are not requiring them to be masked, and however, that might change in the coming weeks depending on the respiratory viral season starting. I think right now the recommendations is that if anybody has been exposed to COVID, you should wear a mask until you finish out your testing, and then also anybody that obviously has had COVID, has finished those 5 days of isolation and going back to work, you still need to wear a mask to finish out that 10-day of isolation. And then I wouldn't be surprised if like classrooms or clinics, if they have increasing cases in their office space or in this classroom, they may be asking everybody to mask for a period of time until that incubation period is finished.
Okay, so that was going to be my follow-up was, what do we do if we are sick, and that is that 5 days incubation time or whatever, that you stay home, that kind of thing, if you do feel sick?
Right, so a lot of people have been asking, like, does the isolation, the quarantine period, has that changed? So nothing has really changed in that aspect. So if somebody has COVID, we really need you to stay home, for those 5 days. And then those subsequent 5 days, once you're returning back to your workspace and such, to be wearing a mask, especially if you're having to go out, even in the early phases, it makes sense to definitely wearing a well-fitted N95.
Okay, well, we have more to talk about. We're going to switch to RSV and flu coming up after the break. We'll be right back.